Hello, everybody. My name is Brian Lawler. I'm Professor of early psychiatry at Trinity College Dublin and Deputy Executive Director of the Global Brain Health Institute. Today, we're going to talk about a brain health proposition, how we can create healthy brains for healthier societies. So what is brain health? Brain health is not simply the absence of brain diseases. Brain health is about getting the most out of your brain, reducing the risk to your brain, protecting your brain, and building resilience, and what we call cognitive reserve over your lifetime. Cognitive reserve is your brain health pension. It's a brain that's more resilient to wear and tear and to the development and impact of brain pathologies later in life. Our brain is our most important asset. There is no health without brain health. Our brains are plastic. Nerve cells can grow and increase their connections in response to stimulation and experience. We also know from scientific research that there are risk and protective factors for your brain health over the lifespan, that many of these factors are not fixed, and that we can modify them. There are many advantages to the concept of brain health, not least that it's a health-promoting value, like physical fitness. It's achievable by all citizens once they have the right knowledge and skills. And unlike mental health, the concept of brain health is non-stigmatizing. Let's look at the context. We have a world that's aging, a workforce that's aging, and more people are developing dementia with greater care demands for families and for workers. There's more stress and burnout at home and in the workplace, with very significant increased care costs. The numbers of people living with dementia are increasing exponentially, with an estimated 20 million people projected by 2050 unless we can develop disease-modifying therapies or preventive approaches. This is all placing huge pressure on our healthcare systems, our economies, on our families and on our employees. The projected care costs in Europe for dementia are estimated to be at least 250 billion by 2030. Added to that right now is the impact of COVID-19 in terms of the stress, the loneliness, and the depression, particularly on our healthcare workers. So we need to find ways to reboot and boost our brain health post-COVID-19. How can we do this? We can see here on this slide that there are many risk and protective factors for brain health across the lifespan. For example, low levels of education, traumatic brain injury, excess alcohol use, hypertension, hearing loss, loneliness, depression. By increasing awareness, knowledge, and by providing strategies to citizens to address these risk factors, we can improve cognitive reserve and resilience and potentially reduce the numbers of people living and dying with dementia over the years to come. Here's a modeled example of what can be achieved if we could implement successful treatment of high blood pressure, bring about smoking cessation, and introduce hearing aids for people that have midlife hearing loss, all of which are modifiable risk factors for dementia. Such a program would reduce dementia prevalence over time by about 8.5%, with significant cost savings and an improvement in the quality of life. This has been modeled in the UK, but you can multiply this by 20 to show cost savings for such a program across Europe. So the brain health proposition is that by taking a public health approach to brain health, we can build resilience and cognitive reserve at an individual and at a population level. This will lead to a reduction in dementia and other brain diseases such as depression over time, create a more sustainable workforce, and improve citizen well-being, both at home and in the workplace. And most importantly, it will increase our dementia-free life expectancy, which is essentially adding quality years with good brain health to your life. However, the big issue is how do we bridge the knowledge and awareness gap on brain health? As you can see here, there is a very poor knowledge and awareness amongst the general public and indeed amongst healthcare professionals about dementia, what are modifiable risk factors, and very importantly, how do we address and reduce modifiable risk factors? So there are 3 levels of prevention and we need to target all three of these. At the primary prevention level at the base of the pyramid, we must provide information, public health messaging, signposting, and increased awareness around brain health to a broad range of stakeholders. These include citizens, teachers, children, policymakers, and planners. At the secondary prevention level, we need to target at-risk groups whose brain health is already under pressure. For example, informal caregivers under stress, workers at risk of burnout, younger retirees who we know are at increased risk of developing dementia. We must provide these at-risk groups with knowledge, skills, and strategies to mitigate this risk. At the tertiary prevention level, we should improve care for people living with dementia by targeting healthcare professionals that are working with this patient group and by helping them to acquire the skills and strategies to improve their own brain health, but also to transfer these brain health strategies to improve the brain health of the people that they care for. So how does the brain health approach training work? People learn about brain health and how to reduce dementia risk factors. This protects and builds their own brain health and increases their own brain capital and resilience. They also learn strategies to support and promote the brain health of the people they care for example, people living with dementia. New knowledge and strategies around brain health also provides nudges and nurtures brain health promoting values in the people that live and work around them, their families, their children, their co-workers, and their friends living in their community. Here are some case examples of how taking a brain health approach would actually work. Healthcare workers caring for people living with dementia are under increased stress, particularly now in times of COVID-19. As part of the brain health approach, they receive educational training on brain health strategies. This increases their mental resilience and contributes to decreasing their own risk of burnout and supports a more sustainable workforce. A second example is for occupational therapists who are working in the community, who generally advise on safety risks for older people living at home. However, they focus primarily on physical disabilities. As part of the brain health approach, they would receive specialist module training on design and adaptation for sensory and cognitive impairment. By incorporating this new knowledge into their advice to older clients, particularly those people living with dementia, on average, people living with dementia would be able to stay at home 6 to 12 months longer with very significant healthcare cost savings, but also an improvement in their quality of life. So we believe that brain health can do for dementia what heart health did for heart disease. We are facing many threats to brain health over the next 20 to 30 years. And for this reason, healthy brains must be at the heart of our strategy for sustainable health and work competitiveness. Taking the brain health approach is health promoting and life affirming and can mitigate the threats to our citizens' brain health. Many risk factors for brain health are socially determined, and structural inequalities such as access to healthcare, socioeconomic status, and poverty are major factors in determining brain health outcomes at a population level. To make sure that we can deliver fair and equitable access to risk reduction, we must tackle environmental and upstream issues such as, for example, the price of healthy foods, access to exercise facilities, and create healthy environments for exercise, sport, and social engagement. Our built environments and communities must provide ready access for all to services and to personalized prevention programs if we are to truly deliver brain health for everyone.